Have you ever watched the news reporting on a disaster in our community and wanted to know more about what was happening behind the scenes in a response? Maybe you or someone you know has responded to an emergency and you were curious about who the planning and response partners are in our region and how we all work together. If these questions have piqued your interest, then this video is for you. You will learn more about the people and the organizations that respond to emergencies and how they work together. You'll also get a sense of where the Medical Reserve Corps, or MRC, fits within a larger community response. First, let's talk about the purpose and focus of emergency response planning. While emergency management offices spend a great deal of time planning, the single most important outcome of a written plan is the relationships that form during the planning process. As President Eisenhower said, "I've always found that plans are useless, but planning is indispensable." Nearly every large emergency has a health or medical component. That's why local public health agencies are at nearly every planning table to coordinate the health and medical resources needed during an emergency. In our region, MRC units are housed in public health departments. As an MRC volunteer, you are an important piece of their response. When we are developing emergency plans, we work with many partners. All of these partnerships help us establish and solidify relationships and better, more robust plans. Our public sector partners include cities, counties, and states. We also partner with private industries and nonprofit organizations to achieve our goals. But there are also specific planning bodies. For example, the Northwest Oregon Health Preparedness Organization, a healthcare coalition, focuses on the synergy of bringing emergency medical services, hospitals and health systems, emergency management, and public health agencies together to solve large-scale emergent challenges like mass burn care, mass trauma care, pediatric surge planning, and emerging infectious disease care. 5 counties in the Portland metro area have formed a regional disaster planning group called the Regional Disaster Preparedness Organization, or RDPO. The RDPO strategically coordinates planning, training, and exercising throughout the region and across emergency management disciplines. There are many work groups, standing committees, and task forces that include law enforcement, public health, emergency medical services and fire, public works, and many others. Public health organizations and other key health representatives come together to form the Public Health Work Group of the RDPO. This group determines gaps in preparedness and coordinates projects to fill those gaps, including projects with the Medical Reserve Corps. The Citizen Corps Work Group of the RDPO coordinates the funding and regional programming for all the voluntary agencies like the MRC and the Community Emergency Response Teams, or CERT. The City's Readiness Initiative is a regional program in our area that focuses on bioterrorism and points of dispensing, or POD, planning. PODs are pop-up clinics that are set up by public health to get pills or vaccine into people very quickly. This is an important element in the response to a bioterrorism event in public health agencies. It's also important to know what types of public health threats we plan for, so you can better understand the response partners involved. We know that we are at risk for a large Cascadia subduction zone earthquake, so we work with partners to plan for that event. Inclement weather happens every year, so we continually improve on those plans, as well as our mass care and shelter planning. We also plan for large-scale public health emergencies like pandemic influenza or other infectious disease outbreaks. So how do you fit into all this? MRC volunteers may be called up to work in a variety of settings. You may be asked to work in a shelter or in a vaccine pod. You may be asked to assist a local hospital or healthcare organization with basic patient care. MRC volunteers can also work in a call center in support of a response. These are just a few examples of where you, an MRC volunteer, might work. Let's use a real-life example like the 2017 Eagle Creek fire incident to walk through what the hierarchy of a response might look like from the bottom up. And remember, we're not talking about the incident command structure. We're talking about who the players are and how we are likely to work together in a growing response. The Eagle Creek fire started in Hood River County and quickly moved into eastern Multnomah County. It also jumped the Columbia River into Skamania County, which is in Washington state. Firefighters got to work and people in the area were evacuated. The weather was scorching hot and the smoke from the fire caused poor air quality, which is a public health concern. The counties opened up their emergency operations centers to manage the response in their counties. The governor declared a state of emergency, and the Office of Emergency Management for Oregon activated its Emergency Operations Center to monitor the fires across the state and support the response of local jurisdictions. The counties provided information to the state, and the state provided information and resources to the counties. Different state agencies were involved and worked through the Office of Emergency Management to assist. The fire raged on, and federal resources came to assist Oregon. In this example, we worked with the U.S. Forest Service in the Joint Information Center. In a large public health emergency, we may receive assistance from the Centers for Disease Control and possibly other federal agencies. That's how a response works vertically, from the bottom up. Now let's discuss how we work side by side with other partners in our region. It's important to note that cities and counties have different roles, but work closely together, collaborating on planning and response efforts. Depending on the type of emergency, the jurisdiction it falls under, and the capacity of that city to respond, the county may work alongside a city, or we may wrap around the city's own response. Within a response organization, there are people who do planning, logistics, finance, and operations. But there are also functional roles for all the different parts of response, including health and medical support. In a public health emergency, the medical and health support might work most closely with mass care and sheltering, food and water safety, transportation, law enforcement, fire bureaus, or search and rescue organizations. In other emergencies, health and medical support might play a less central role, but there is virtually always a health or medical element to any response. All of the parts of response work simultaneously and alongside one another to form a cohesive response. It's the job of the people that work in the County Emergency Operations Center to coordinate all these functional areas. The components of health and medical emergency support include hospitals and other healthcare providers, public health authorities, emergency medical services, behavioral health services, nursing facilities, and medical supports for sheltering operations. There may be people working on all these separate areas who report to the health and medical function of the county or state emergency operations center. Different counties or jurisdictions may not use these exact same terms, but they all work in a similar way despite slightly different terminology. In larger emergencies which cross more than one county or even more than one state, you'll find different jurisdictions working together on many levels and joining together in a more streamlined, unified command structure. Earlier, we mentioned that part of the health and medical response to an emergency is to work closely with organizations that support shelter operations. Our primary role is to organize medical staff and volunteers to work in the shelters, but the health and medical function does not operate the shelters themselves. Let's use a large public health emergency to walk through another example of response structures and where the MRC fits in. Let's say there's an outbreak of measles in a Portland school where the majority of children are not up to date on their measles vaccines. There are more cases and contacts in neighboring counties, and several children have been hospitalized. The health department is overwhelmed trying to track down all the contacts throughout the region. There's a great deal of media attention, and we are in the midst of planning a prophylaxis pod for contacts and immunization clinics for the community. The health department has activated its incident management team and opened its incident command post. Because of the volume of media inquiries and resource requests, the county opened its Emergency Operations Center to support the health department with logistics and a joint information center. State Emergency Management also opened its Agency Operations Center to help coordinate the response among the different impacted counties. Hospitals activate their own emergency operations centers to quickly discharge patients and maximize space to care for a surge of incoming patients. The Northwest Oregon Health Preparedness Organization partners with county emergency operations centers and the Oregon Health Authority to ensure that regional healthcare situation status reports are shared and that hospital resource requests are received and processed. If public health decides to open prophylaxis or immunization pods, then MRC volunteers would be asked to work at them. Or you may be invited to answer questions from the public at a call center. Whatever task you are assigned, it will be based on utilizing your specialized skills to help the most people. Whether it's a small-scale localized event or an overwhelming statewide response, we have plans and structures in place to meet those challenges. But most importantly, we have long-standing relationships with people like you and agreements with partners in communities throughout the region, and we are always working to improve on our plans, exercising our roles, and anticipating how to improve our service to the community.